By 2030, the number of people living with dementia will be over 1 million. Left untreated, the number of cases will triple. The annual cost of dementia to the Canadian healthcare system is over $10.4 billion. Therefore, it is essential to identify prevention strategies to reduce the cases of dementia as well as the mortality rate. Primordial prevention consists of actions taken at the systematic level to modify population health and inhibit establishment of factors that tend to increase the hazard of a disease. They target the underlying stage of a disease by targeting the social conditions that promote the disease onset. Actions such as policies and legislations taken at the systematic level can reduce the risk of the development of dementia.
Study shows that individuals with lower education, lower income, and who live in a poorer neighborhood are at a high risk of developing dementia. Zhu and colleagues conducted a systematic review that includes 15 prospective cohort studies for low education and 8 prospective cohort studies for high education. The study found that dementia risk was reduced by 7% for every year of increased education. Seniors living in a low socioeconomic neighborhood are at a high risk of developing dementia. Low socioeconomic neighborhoods are exposed to noise and air pollution, have limited access to open space and parks for physical activities, and have less access to resources such as healthcare centers, libraries, and recreational centers. Library center or recreational center are essential for social engagement and cognitive development.
Primary prevention involves preventing the onset of disease by reducing risk factors. Although non-modified risk factors such as age and genetics cannot be changed, individuals can reduce the risk of developing dementia by targeting modified risk factors. The Lancet has highlighted 12 common risk factors associated with dementia. These risk factors include low education, hypertension, hearing loss, traumatic brain injury, excessive alcohol consumption, obesity, smoking, depression, social isolation, physical inactivity, diabetes, and air pollution. Let's look at some of these risk factors and further details and steps that you can take to minimize your risk of developing dementia.
Traumatic brain injury that results from sports, military combat, motor vehicle collisions, and fall can increase the risk of dementia. Moderate and severe traumatic brain injury has been shown to increase the risk of dementia by 2 to 4-fold. A meta-analysis of 15 case and control study shows that individuals who had a head injury followed by loss of consciousness are 50% more likely to develop dementia. Preventive measures such as wearing proper headgear while cycling, skiing, or playing contact sports can reduce the risk of dementia. Other measures include making sure your car is in good shape, wearing seat belts, and following the rules of the road. Fall is the most common leading cause of injury among the elderly, and thus using a mobility device and fall-proofing your home can prevent injury and deteriorating dementia. Persistent hypertension in midlife has been associated with the development of late-life dementia. A Framingham cohort study conducted with 1,440 patients found that patients with elevated systolic blood pressure or 140 were at increased risk of developing dementia. Hypertension has been shown to cause severe functional and structural development of the brain, leading to cognitive impairment and dementia. While there are pharmacological interventions such as antihypertensive treatment to treat hypertension, non-pharmacological interventions such as exercise and diet have been shown to reduce the risk of hypertension and dementia. Studies have shown that exercise improves systolic and systolic pressure by reducing 5 to 7 milligrams of mercury and improves cognition. Studies also have shown that Mediterranean diet can reduce hypertension and dementia by 1/4. Some of the tools that are used to diagnose dementia includes biomarkers, brain imaging, cerebrospinal fluid testing and blood test. Examples of common brain imaging and scanning techniques includes computerized tomography, magnetic resonance imaging, and positron emission tomography. The CT scan shows areas of shrinkage in the brain. The physician might compare the patient's brain to an individual's brain of the same age. Any difference might indicate potential dementia. Similarly, magnetic resonance imaging uses radioactive energy and a magnetic wave to produce an image of the brain. Any shrinkage in the region of the brain can detect Alzheimer or dementia. Positron emission tomography uses radioactive substance to measure brain activity and chemical abnormalities. Positron emission tomography shows that patients with Alzheimer's disease have reduced glucose level in regions of the brain that are responsible for memory, learning, and problem solving. Plaques such as beta amyloid is a hallmark of Alzheimer's disease. Cerebrospinal fluid provides nutrients and proteins to maintain the health of the brain. Proteins and other substances made by the brain can be detected by biomarkers, and any changes indicate the potential for dementia or Alzheimer's disease. Doctors can perform lumbar punctures to obtain fluid. Markers such as beta amyloid, tau, and phospho-tau detect Alzheimer. Other tests such as blood tests can be employed to measure for proteins such as tau, beta amyloid, or other biomarkers that can detect Alzheimer.
Tertiary prevention activities are those that are aimed at preventing further deterioration or progression of an altered state of health or condition. The lack of intervention can reduce patients' cognitive and functional abilities. This increases the patient's risk of being institutionalized and hospitalized and increases the risk of mortality. Exercise and music therapy are non-pharmacological interventions that have been shown to improve the health and well-being of patients with dementia.
A randomized controlled trial was conducted among 109 patients with dementia. The patients were split into 3 groups: the aerobic group, a combined group with aerobic and strength exercise, and the social group. The intervention held activities for 30 minutes a day for 9 weeks. The finding of the study suggests that individuals who engaged in combined activities showed improvements in areas such as cognition, visual memory, verbal memory, and executive function. The study also found improvements in motor skills such as walking endurance, leg muscle strength, and balance. The finding of the study suggests physical activity reduces the motor and cognitive decline in patients with dementia. Music therapy is the clinical and evidence-based use of music as an intervention by a accredited professional to assist patients in accomplishing individualized goals. Music therapy can trigger parts of the brain, such as the hippocampal region, which triggers long-term memory. This process is called the reminiscence effect, which is the ability of older adults to listen to music that help them better recall specific autobiographical information that happened while they were in their early 20s or teens.
Voluntary prevention is a group of actions or measure that seeks to prevent, monitor, or alleviate possible harm caused by an intervention or medication.
In Canada, 30.2% of residents in long-term care are prescribed antipsychotic medication. Adverse effects of psychotropic drugs include cardiovascular and metabolic effects, falls, cognitive worsening, and infections. Higher rates of hospital admission and mortality have been reported after short-term drug use. These drugs are often used as sedatives to restrain the patients. Caregivers should use non-pharmacological therapies such as music therapy to reduce psychological symptoms.